Welcome, everyone. My name is Rachel Massey, and I'm the Senior Science and Policy Advisor with CHA, the Collaborative for Health and Environment. Please feel free to put a note in the chat introducing yourself and where you're calling in from if you'd like to. I'm just going to cover a few bits of housekeeping before we get started. CHA is a member group of the EDC Strategies Partnership, which is bringing you today's webinar. The partnership members include Healthy Environment and Endocrine Disruptor Strategies, or HEEDS, a program of environmental health sciences, the Biomonitoring Resource Center, and the Health and Environment Alliance, or HEAL. CHA also hosts science discussion listservs and supports other collaborative programs focused on promoting environmental health and justice. If you're joining by phone, you can download the slides from the webinar page on our website at healthandenvironment.org. And just a note that the slides and resources section on that webpage includes links to the studies that Dr. Eskenazi will be referring to today. So if you'd like to follow up and read the studies after this webinar, you can find them there. For those who are online, we'll put that link in the chat now. We're going to disable the chat during the presentations, but please do type your questions in the Q&A box at any point, and we'll get to as many comments and questions as we can after the presentations. And if you'd like to activate closed captions, you can do that by clicking the button on the bottom of your screen. This webinar is being recorded, and the presentation itself will be about half an hour. So we'll then take another approximately 10 minutes after that for questions and answers. And with that, I will hand it over to today's moderator, Sarah Howard, Program Manager for HEEDS. Sarah?
Thank you, Rachel. Hi, everybody. Welcome. Today, we're going to hear from Dr. Brenda Eskenazi, who's going to discuss the results of a long-term study on exposure to the herbicide glyphosate and the development of liver injury and metabolic syndrome. Dr. Eskenazi's director is, I can't talk today. She's director of the Center for Environmental Research and Community Health at UC Berkeley's School of Public Health. She is the Jennifer and Brian Maxwell Professor of Maternal and Child Health and Epidemiology. Her work involves community-based participatory research looking at the effects of environmental chemicals on children's health. All right, so Dr. Eskenazi, would you like to begin?
Thank you for the introduction, and thank you all for being here. So today I'm going to be talking about the long-term associations of childhood glyphosate exposure in the CHAMACOS study. Our study, the CHAMACOS study, stands for the Center for Health Assessment of Mothers and Children of Salinas. CHAMACOS means kids in Mexican Spanish. We started our study about 25 years ago in the Salinas Valley, and we're a community university partnership. For those of you who don't know where the Salinas Valley is, it's on the central coast of California, and it's also the salad bowl of the nation. That's where most of your salad comes from. In 1999 and 2000, we enrolled about 600 pregnant women from clinics serving farm workers in the Salinas Valley. Almost all women were Spanish-speaking. Almost all women were born in Mexico, and about half had been in the United States for less than 5 years. It means that probably at least half were undocumented at the time that we enrolled them in the study. Almost all lived within 200% of poverty because one of the requirements is that they were eligible for Medi-Cal. They had low levels of education. If they themselves were not working in agriculture, usually they lived with someone who worked in agriculture. Since then, we have followed the mothers and the children about every year or two, and we added a second cohort at age 9. So these children, CHAMACOS 2, were born in the same years as CHAMACOS 1. We have followed them, as I said, about every year or two, and now our children are young adults. They're 22 years old. We have evaluated the health and development of the children and the youth at each visit, interviewing the mothers, testing the children, determining when they entered puberty through Tanner staging, measuring the anthropometry, liver and metabolic disease, evaluated respiratory function. We've also assessed brain function. When they entered into adolescence, we began to look at risk-taking behaviors, and most recently, we are now currently doing MRIs on the mothers. We have collected a large biorepository, primarily to measure pesticides as well as other chemicals. And we have saved this in a storage at -80. We've collected urine, blood, breast milk, saliva, hair, teeth, as well as environmental samples such as house dust. We have collected more than 400,000 samples, and they have been stored. We have also collected geospatial information, meaning that we were able to register every single residence the mother lived in during pregnancy and the child has lived in up until 18 years of age. Because of the pesticide use reporting data, which is unique to California, we can actually geocode where they lived relative to applications of pesticides. The pesticide use reporting data, as I said, is fairly unique in the United States, and it records use within a kilometer of the residence, the date and time of use as well. We have studied many pesticides as well as other environmental exposures, organophosphates, pyrethroids, fungicides, organochlorines, fumigants, sulfur, as well as other chemicals. But today I'm going to be talking about our results with glyphosate. So this is a timeline of the amount of agricultural pesticide use in Monterey County, where the Salinas Valley is located. And you can see that organophosphates, which is red here, has decreased substantially since we started our study in year 2000. But during that period of time, the use of glyphosate has increased, and I'll show you specific maps later on. So our recent focus has been on glyphosate. It is the most commonly used broad-spectrum herbicide worldwide. We have seen a dramatic increase in the United States in the last 2 decades. It has been used mostly for control of grass and weeds, but widely in agriculture, forestry, right-of-ways, parks, golf courses, and yes, you can still buy it in wherever you buy your products for your use in your yard. It's found primarily in food, in grains and beans and legumes. And it's eliminated in urine as glyphosate and as a metabolite or a degradant product, aminomethyl phosphonic acid. AMPA is also a product of other phosphonates, but most of it is coming from glyphosate. Up until now, the main health outcome of concern has been glyphosate in cancer. IARC labeled glyphosate as a probable carcinogen to humans in 2015. However, EPA in 2020 said there was no risk of concern to human health when glyphosate is used according to the label, and that it is not a carcinogen. The European Commission has extended the use of glyphosate until December 2023, and it's now undergoing peer review. As you can see in the headlines below, there have been a number of cases around glyphosate and cancer, and it's been very controversial. So how we got involved in looking at liver and metabolic disease. It actually is based on a clinician that was seeing kids in the Salinas Valley. His name was Charles Limbaugh. He's actually an author on our paper. He is a family practitioner, and he noted that he was seeing more and more liver disease and metabolic disease in the children living in the Salinas Valley. He had read an article by Paul Mills and approached Paul and said, "Hey, I saw in your article that you saw a relationship with NASH, or non-alcoholic steatohepatitis, and glyphosate excretion. And I'm wondering if what I'm seeing in the Salinas Valley with this increase is due to the exposure to glyphosate." So they then approached me, since I had a longstanding study in the Salinas Valley, and said, "Can you do a study?" And I said, "Well, we happen to have all of these urine samples already stored, and we're in the process of collecting information on liver disease and metabolic disease in our children. So why don't we just pull the samples and analyze those data? And that was the beginning of our study. As I mentioned earlier, glyphosate use has increased drastically in the United States over the last 2 decades. If you look at the glyphosate use in the Salinas Valley in Monterey County, in 2000, when our study started, it was much lower than it was in 2018 when our children turned 18 years of age. And particularly starting around 2008, it crawled up. So that brings me to the methods of our study. At the time that we were doing our 18-year assessment of our children, in the middle of the study was when we had the shelter in place over COVID. But at that point in time, we had already enrolled 480 mother-child dyads before the shelter in place. And since then, we have enrolled the rest, but we didn't want to use those children in this study because we were concerned that the events of COVID may have actually changed their metabolic disease. So for 480 mother-child dyads, we had residential information, so we could geocode, and we had blood measures. And we decided to do a nested case control study where we identified those children that had elevated transaminases indicating liver inflammation based on AST or ALT transaminase. And we had 60 children out of the 480. We then frequency matched on sex and selected 91 controls with normal liver transaminases. So this case control study was nested amongst the 480. We then had 2 major exposure measures. One, as I said before, we've geocoded all of their residences, but we were particularly interested in the residents during pregnancy and the residences up until age 5 of the children. We also had the urinary measurements of glyphosate, and we also measured AMPA in those urine measurements, and we calculated something called glyphosate residue. We send these urine samples to the National Institute of Public Health in Quebec, Canada, and they measured these metabolites, these measurements. We selected specifically the urines from the mothers during pregnancy at 26 weeks gestation, and of the children at 5 years, 14 years, and 18 years of age. We selected the mothers at 26 weeks and the 5 and 14 because at the very same time, we had a very detailed food frequency questionnaire. And at 18 years of age, we selected that because it was concurrent with the measures of liver transaminases and metabolic syndrome. Our outcome measures were the liver transaminases in the blood, and we had this for the 480 children. And we were also able to assess metabolic syndrome. And metabolic syndrome is defined by having any 3 of the following measures: high systolic or diastolic blood pressure, large waist circumference, elevated fasting serum glucose, elevated serum triglycerides, or low HDL cholesterol. So as Dr. Lindberg found, we confirmed in the CHAMACOS cohort a very high level of obesity and overweight. More than half of our children were obese or overweight, and more than 10% had metabolic syndrome. We saw nearly 15% had elevated liver transaminases, and this is in the 480 children. We also looked, as I said, we geocoded the houses that the children and the mother lived in during pregnancy, and we were able to look at agricultural use nearby their residences. And you can see in year 2000, when the children were in utero, in 2005, when they were 5 years, in 2014, 14 years, in 2018, there is a progressive increase in the amount of use, as you can detect by the darker red. The darker the red, the more use of glyphosate, and this is in the Salinas Valley. So we looked at the relationship with the outcomes, the metabolic syndrome and the liver enzymes in 3 different ways. We looked at the urinary glyphosate, AMPA, and glyphosate residues and measured individual time points. And then we also used something called a multiple informant model, which allowed us to put together all the exposure time points in the same model. We were only able to look at the urinary measures if there was greater than 50% detection. And we found low-level detection in pregnancy. So for most of the analysis, we could not include the pregnancy measures. Glyphosate residues is a measure that was put out by WHO to be able to combine AMPA and glyphosate. And you can see by the formula at the bottom, it's mostly driven by AMPA. It has to do with the molecular weights of glyphosate and AMPA. So it would be no surprise that the results that we see for AMPA would also be seen for glyphosate residues. So the main analyses for urinary is glyphosate and AMPA and glyphosate residues. And then we also looked at exposure determined by the pesticide use reporting data in pregnancy and childhood, averaged over 0 to 5 years. So what are our results? And on this slide, what I'm showing you is the urinary measures that are specific gravity corrected in micrograms per liter. And I'm looking at the relationship in the relative risk per 2-fold increase in that urinary measure. And here we see the point estimates and the 95% confidence intervals, the relative risk and the 95% confidence intervals. And we have the liver transaminases here and the metabolic syndrome. And you notice that pregnancy and 5 years is not included here because we had less than 50% detection. And therefore, it's also, because it's a composite measure, not in the glyphosate residues as well. And what we see is that there is a significant relationship with AMPA measurements and elevated liver transaminases, and also AMPA and metabolic syndrome. But what you can also see is that all of the relative risks are above 1. So none of them are inverse, which suggests that there is an association, but minimal for some of the others, but only significant for the ones that I have circled here. Now, I also mentioned that we had used a multiple informant model, which allowed us to accumulate all of the exposures. And here again, we're looking at the relative risk per 2-fold increase, again, for the liver transaminases and the metabolic syndrome. And what we see is an association between AMPA and glyphosate residues, about a 14% increase per 2-fold increase in AMPA and glyphosate residues, and elevated liver transaminases. And we see about a 55% increase with metabolic syndrome and AMPA and glyphosate residues per 2-fold increase. And notice at the bottom, all the models, the ones I showed before and the ones I show now, are adjusted for all of those different covariates. Now, in terms of the pesticide use reporting data, again, it's the residents during pregnancy and during the period of 0 to 5 years of age in the child. We could no longer look at exact number of use during pregnancy because it was so low detection. So we only looked at, was there any use or no use nearby the prenatal residence? But for the postnatal use, we were able to look at the amount of use per 10-fold increase, per 10-fold increase within a doubling of increase in kilometers in use within 1 kilometer, in kilograms within 1 kilometer, sorry. And you see here that within the case control study only, that's the nested case control study, we do see a relationship of nearby use and metabolic syndrome, both prenatal use of any or none and postnatal use in actual kilograms of use. We have other results that I just want to report. Our results are not mediated by the body mass index. As I showed you earlier, more than half of our kids are obese or overweight. And so we wanted to be sure that the findings on liver enzymes and metabolic syndrome was not purely driven by just eating bad foods. And our results are not mediated by BMI alone. We did see higher detection for AMPA than for glyphosate, but then they are correlated. And we saw the highest detection at age 14 years, even higher than 18 years, even though there's about the same kind of use. Part of that reason is at 18 years, many of the children had fasted when they provided the urine sample. That's because they were fasting for the blood sample. However, even when we take out the children that had fasted, we still see higher levels at 14 years. And one of the reasons we're thinking is that they had different diets. We do see that diet is correlated at 5 years. Those children that ate cold cereal had higher AMPA and glyphosate residue concentrations. And at 14 years, those children with higher caloric and carbohydrate intake, as well as those who consumed hot cereal, bread, fruits, and vegetables, had higher glyphosate levels. We saw that glyphosate urinary measures were not correlated with the PUR, but it was PUR data was weakly correlated with AMPA. So what's the potential mechanisms by which we see our findings? There have been a number of animal studies that have suggested that glyphosate produces oxidative stress, and that might be a potential mechanism for metabolic syndrome. We also see some studies that have showed that there is altered, again, animal studies, alteration of gut microbiota with glyphosate exposure. Again, that could be a potential mechanism. Another potential mechanism that has just begun to be studied is the glyphosate's relationship with endocrine disruption. There have been some studies that have shown a relationship with change in reproductive hormones. So there's definitely more research that needs to be done on the potential mechanisms. Our study does have a number of limitations. Glyphosate is a short half-life chemical. A single spot urine sample is not going to completely measure the exposure to glyphosate or to AMPA. We would have to take 24-hour urine samples over the entire life course to be able to accurately measure exposure. And even though we took multiple measures and we measured glyphosate in multiple samples, it's still not sufficient. The pesticide use reporting data, although unique in California and very special, it does not reflect all nearby exposure. We did not take GPS coordinates of the schools, the workplaces. We did not estimate non-ag use. There may be differences by formulation of glyphosate. We used a food frequency questionnaire, but there may be inaccurate dietary recall. The exposure was particularly low during the prenatal period, although our study did show that during childhood, our range of exposure to glyphosate was within what we see in the NHANES, the National Health and Nutrition Examination Survey, for children of the same age at the same time point. So our levels unexpectedly were not higher than the general US population. However, NHANES did not measure AMPA. In a study that was done in Germany at around the same time in children of around the same age, we do see our AMPA levels to be higher than the general German population of children. And the pathways of AMPA are really not well defined, although there have been studies that have identified that it's likely coming from food and water, and it's not coming from the phosphonates, but from glyphosate itself in the environment. The strengths of our study is California's unique pesticide use reporting data, that we did have 2 measures of exposure, including measures of not just glyphosate, but AMPA. It is a longitudinal study, and it's of a farm worker population where we had expected we'd have higher levels of exposure, but did not than the general population. And as I said, our exposures are not higher than the general US population. What are our next steps? We do have 480 children with stored urine samples. We could be following up the entire population, not just in the nested case control study. We have, with a larger sample size, if this is an endocrine disrupting chemicals, we can look at sex differences, which we couldn't do in a smaller sample. We can look at multiple health outcomes in our study that we haven't looked at, not just cancer, but include reproduction and other endocrine function now that our children are of reproductive age. We can look at glyphosate and AMPA within pesticide mixtures, which is more complex statistical analysis, but with larger sample sizes we can do. But what we can't do is, and what we do need to do, is we need to have studies with more frequent measures of exposure, and we need to studies now that are collecting data in pregnancy, because the exposure are higher now than they were in 2000. And we need to look at what in utero exposures are doing to the health of children. We need to better study the pathways of AMPA exposure, which means we need to measure AMPA. In the last 5 years, there has been a lot of emerging human health data, not just about cancer. In utero exposure and lower birth weight, in cohort studies, shortened gestation, preterm delivery, higher NICU admissions, developmental delay in a case control study, in a meta-analysis on Wilms tumor in children, cross-sectional studies looking at oxidative stress in AMPA, and in an NHANES cross-sectional study, a decrease in estradiol and testosterone. So in conclusion, we are seeing a relationship of exposure to glyphosate, the most commonly used herbicide worldwide, and AMPA, a degradation product of glyphosate, as well as phosphonates, but mostly glyphosate in early childhood linked to liver inflammation and cardiometabolic disease. We are also seeing at the same time a drastic increase in liver disease and metabolic disease in children in the United States, which is grounds for concern. Although previous research on glyphosate in humans has largely focused on carcinogenicity, our study indicates the need for further investigations of metabolic and liver outcomes because of many other outcomes that need to be studied as well, not just metabolic and liver outcomes because of this increase in use of glyphosate. And also, we need to be following up our children because liver inflammation, cardiometabolic disease in our children is also going to increase their risk for liver cancer and diabetes and other metabolic diseases, cardiovascular diseases in adulthood. This is the reference for our study. I'd like to thank my colleagues at CERCH, the Center for Environmental Research and Community Health. I'd like in particular to thank Anna Maria Mora, who has worked very hard with me on this project, Paul Mills and Charles Limbach, the clinician that I spoke about at the clinics in Monterey County, and Paul for his work on liver and helping to fund this study, and all of our funders, especially the National Institute of Environmental Health Sciences. And a very special thanks to the families who have participated over this 25-year study. And thank you. This is our website. Thank you for attending today.
Thank you, Dr. Eskenazi. That was great. I am going to read out questions from the Q&A feature. So we have plenty, but I'm just going to start quickly. If you have more, you feel free to ask them. So a couple people asked about the timing of collecting urine samples and seasonality of glyphosate. So like, is glyphosate used in, is there seasonal variation in glyphosate use? And did you collect the urine samples according to that seasonality, or did you see seasonality in the urine samples?
Our children were enrolled over a 1-year period. So we did not actually have a large enough sample size in this nested case control study. In the larger 480, we could look at seasonality, but we couldn't look at it within this study. Presumably, the 150 urines that we did analyze would be over the 1-year period.
All right. Somebody else asked, did the children in the study work in agriculture, or is it just the parents?
Very, very few of our children are working in agriculture at this point. The parents are the ones working in agriculture. Our children could have worked in agriculture during the summers, but certainly not at 5 years and probably not at 14 years.
All right. And then there was questions about the exposure, the major source of exposure to glyphosate or AMPA, I guess. Would it be like food the kids were consuming, or do you think it's the from the fields or the food basically, or
well,
do we know?
I think it's likely to come from the food and the water. That's only based on studies that have been done on AMPA, the very few studies that have been done on AMPA. I think that, as you saw, the pesticide use reporting data did have a signal for prenatal exposure, but didn't have a signal for postnatal exposure and the liver transaminases and the glyphosate and the metabolic syndrome. So my hunch is most of it's coming from food and water, but we need to do more pathway analysis of AMPA. There just aren't enough studies.
And then someone asked about, did you look for the glyphosate in the house dust or AMPA, I guess? Did you have the samples, right?
We have the samples. I will like to put out just an FYI. Since we published our study, there's been another study by a colleague of ours at UC Berkeley, Catherine Matamea, just mispronounced her name, looking at dust samples and childhood cancer, and also found a signal with glyphosate. And so she did measure the house dust samples. We do have the house dust samples and we could do it. Again, that's another grant, another study.
All right. I'm just going to grab a few here. I wonder how the biomarkers may differ in pregnancy. Do you think the increased non-detects reflect lower exposure levels, or perhaps altered toxicokinetics of pregnancy physiology?
That's a really good question. I wish I knew the answer. I think there's very little on the pharmacokinetics in pregnant women in general, and especially in glyphosate, where we have virtually no information. I think that in our study, it's likely because of the low usage in year 2000. There's been a huge increase in the last decade, and in particular in our area, and in food in general.
Yeah. Are there any other exposures that might be confounders for the effects shown?
Exposures meaning chemicals. We have measured many other chemicals in these children. many other endocrine disruptors in these children. That would take a larger sample size to be able to look at pesticide mixtures as well as chemical mixtures. There's also a problem in looking at mixtures where some things are in urine and some things are in blood, but we're developing methods to be able to do that statistically right now. And with the hope in when we measure the 480 at some point, we'll be able to do that.
And then someone asked, how does this study looking at glyphosate compare to the results of organophosphate pesticide study? And I don't know if they mean a specific one or
CHAMACOS, maybe. In CHAMACOS, we do not really see a relationship with obesity, but we haven't looked at metabolic syndrome yet. We have those data, but we haven't looked at it yet in our study. And yeah, I think that's the answer.
Someone else asked related, I guess, is if there might be impacts of exposure to both the organophosphate pesticides and glyphosate, but I'm assuming.
Yeah, I mean, we'd have to look at that. We haven't looked at that. We did look to see whether organophosphates were a confounder. It wasn't, so we didn't control for that. But that doesn't mean that we can't be looking at that in a mixture later on. We have those data.
All right. Have you looked at the cardiometabolic health and liver status of the mothers or father, for that matter?
Well, we don't have that information on the father.
Fathers.
We do have that information that we're acquiring right now on the mother. We haven't collected blood from the mother till right now. We're actually actively doing a study at this very moment. And the hope will be that we can look at the mothers.
All right. Do you know what the half-life of glyphosate and AMPA in the body and the urine? And is the urine contained in plastic or glass tubes? I mean,
the urine, they store it in glass or plastic tubes. I think I know they were stored in containers that were considered to be okay. I can't tell you exactly what they were. But I can tell you, presumably.
They don't have glyphosate in the tubes.
They don't have glyphosate in them. The half-life of AMPA in humans is between 3.5 and 14.5 hours. And in glyphosate, it's less. It's like 1 to 3 hours. So we're talking about a very short half-life. However, AMPA in the environment has got a longer half-life, and so than glyphosate. And so what we think is happening, again, I'm not absolutely sure, is that glyphosate is degrading to AMPA in the environment, and people are being exposed to AMPA from the environment. It is highly unlikely, because there are people who've actually swallowed glyphosate, researchers that have swallowed glyphosate. It's highly unlikely that the AMPA is due to the metabolism of glyphosate in the body. So less than 1% of glyphosate in the body is degraded to AMPA in the body. So it's mostly exposure to AMPA in the environment.
Okay.
Again, this is research I've done, but a lot more of this research needs to happen.
Does anyone know someone asked about which brands of cereal have highest rates of glyphosate? And someone asked, is it mainly GMO foods that have glyphosate in them? I don't know if you know those.
I can't answer that. All I can say is that we see a relationship with grains and in our study, but I can't say exactly what brands they were eating.
All right. Let's see. Okay, how do Chang et al. Results regarding the elevated markers of oxidative stress? I don't know this question. What is known regarding oxidative stress and markers for metabolic syndrome? How about that?
Okay, again, this is not my expertise, but there was a really good study that was actually published recently in male rats by Prasad et al. That actually looked at insulin resistance in the rats. In terms of oxidative stress, they have also looked at, again, in rodent study, they were able to induce oxidative stress in the pre-adipocytes and other tissues in rodent. The best I can do is probably refer that person to a bunch of different references and let you look at the references yourselves. But there have been a number of studies that have, maybe half a dozen studies that have looked at oxidative stress. There have been researchers that, before we did our study, had hypothesized that we might see metabolic syndrome in humans because of this oxidative stress. And that was one of the reasons why we did our study.
Okay, one final follow-up question. Someone says that databases say the half-life of glyphosate in the soil is about 120 days. She said, are you saying that half of the glyphosate in a sample is several hours? Can you clarify? I think you said the body, right?
In the body.
Yeah, the body is different than the soil.
Yeah, that's well known. AMP has got a longer half-life in the soil, in the environment, in water, than it does in the human body.
Okay, I think that's good for the questions. Thank you so much for the presentation. And I will turn this back over to Rachel.
Great. Thank you so much, Sarah, and thank you so much, Dr. Eskenazi, for sharing this research and for doing this really important research over the years. I just saw a question in the chat about getting the slides. So if you go to our website, healthandenvironment.org, you can download today's slides. And in addition, all of you will be getting an email in the next couple of days with a link to the recording of this webinar. So I'm going to share my screen and I'll just go through some wrap-up announcements. There we go. So again, thanks to all of you for joining today. We encourage you to support the work of any and all of the groups involved in the EDC Strategies Partnership. You'll find links to each group on CHA's partnerships page. If you appreciate these webinars, please consider a tax-deductible donation to CHA and/or any of these partners. We also invite you to join us for upcoming webinars. The next CHA Alaska Partnership webinar will be on Wednesday, April 26th at 1 p.m. Pacific, 4 p.m. Eastern. The title of that webinar is False Climate Solutions, the Destructive Cycle of Nuclear Power in Alaska, from Uranium Mining to Power Generation and Weapons Testing and Nuclear Waste. The speakers are Emily Murray, Vice President of the Norton Bay Intertribal Watershed Council, and Dr. Edwin Lyman of the Union of Concerned Scientists, and we'll put that link into the chat now. So we'll wrap up at this point. I'd like to thank you again very much for joining us today. We hope that you found this information to be useful, and we look forward to seeing you on future webinars. Again, Dr. Eskenazi, thank you so much for speaking with us today. Thank you, Sarah, for your excellent moderation. Thanks to all of you for all the excellent questions that you posed. And finally, thanks very much to CHA Director Kristen Schaefer for all of her behind-the-scenes support. Thanks again.